Good morning, everyone. Welcome to an episode of Coffee Break with CARD, La Hora del Cafecito sister show. My name is Olivia McDonald. I am obviously not Lourdes Quinones, but I would still like to welcome you to the show. Our colleague Lourdes unfortunately had another meeting she had to attend to this morning, but I will try my best to fill the big shoes that, that she has for this show. So anyway, Coffee Break with CARD is a program dedicated to all of those in our community who are living with autism, to their family members, and to all those who support them. So come in, join us at our virtual table, sign in the comment section below and let us know if you're having a cup of coffee or tea or water with us. So in today's program, we have the pleasure of interviewing Whitney Haley and Alibech Prosperi with the Special Day Foundation. They will be discussing with us the common dental issues and challenges individuals with autism are experiencing, how the Special Day Foundation is helping to increase access to important dental care, as well as sharing some ideas of what they've done to better support their patients with autism that other dental practices can also adopt. So join us. We have a lot to talk about. Do that, let's start by introducing you to our coffee break hostesses today. As I mentioned, my name is Olivia McDonald. I'm a professional in the field of public health, and I'm a CARD consultant assigned to the early age team. I'm also a mom of a very active little toddler, and I have a younger brother diagnosed with autism. And then I'm also joined by my colleague, Yasmin Castellano. And as you know, Yasmin is an excellent professional in the field of mental health. She is a CARD consultant assigned to the youth group from middle school to young adults, and is the mother of 3, one of whom is diagnosed with autism. Welcome, Yasmin.
Thank you, Olivia.
Before we get started, we want to review the rules we want to adhere to during this program to ensure a safe environment for us all. So please remember to keep an open mind, a positive attitude, and to use respectful language in those comments. So let me quickly check to see if we also have anyone in our audience we would like to say good morning to. And I want to say hello to our colleague Ima, who's also watching our show. Good morning, Ima. To Mark, Chris, and our number one fan, my mom, Philomena. Good morning, Mom. Okay. And for anyone who's joining, again, please feel free to say hello in those comments. So for those of you who are just joining us in today's program, we have the pleasure of interviewing Whitney Haley and Alibech Prosperi with the Special Day Foundation. They will be discussing with us the common dental issues and challenges individuals with autism are experiencing, how the Special Day Foundation is helping to increase access to important dental care, as well as sharing some ideas of what they've done to better support their patients with autism that other dental practices can also adopt. So join us. We're going to go ahead and get started. So I want to first of all say thank you for being here and good morning to you, Whitney and Ali.
Thank you for the invitation.
Thank you for having us.
Mm-hmm.
Can you tell us a little bit about yourselves?
So my name is Whitney Haley, and I've been a registered dental hygienist for 12 years. I worked in private practice for about 2 years before transitioning to working at the University of Florida for the Special Day Foundation program in Seminole. When I started working with the Special Day Foundation, I did not have any experience working with patients with autism, and I quickly discovered a passion for special needs dentistry and dove headfirst into research, education, and training to better equip myself for my new career.
And my name is Alibech Prosperi, and I'm a dental hygienist as well. And I have 23 years of experience. And I have been working with autistic kids since I started with a Special Day Foundation a year ago.
Thank you both for being here. And if you could please let us know, what is the Special Day Foundation?
Sure. So the Special Day Foundation is a nonprofit organization that provides funding to the University of Florida dental clinics that are located in Seminole, which is Pinellas County, Naples and Collier County, and Hialeah and Miami-Dade County. This funding helps to cover costs of dental treatment for patients of any age with developmental disabilities in order that they may better receive comprehensive dental care. The Special Day Foundation follows the state of Florida statute definition as to who qualifies as having a developmental disability. We also have a fishing program that provides recreational fishing and boating opportunities for children and adults with developmental disabilities. This allows them to enjoy the physical, therapeutic, and social value of nature-based activities, and our recreational fishing program helps participants take a break from the stress of daily life. It also gives them the opportunity to connect with sights, sounds, and relaxation that comes from being outdoors.
And also, what dental services does the Special Day Foundation offer, and at what locations?
So the services provided are all aspects of dentistry. This includes general dentistry such as fillings, extractions, exams, x-rays, oral hygiene care, dentures, etc. And then we also have specialty dentistry such as orthodontics, endodontics, periodontics, oral surgery, and sedation. Our Seminole location provides all the services just mentioned for both children and adults, and the Hialeah location also offers all these services with the exception of sedation. And then Allie can talk a little bit more later on about what the Naples program provides. Each July, the Special Day Foundation starts a new funding year. At the start of the year, a patient will receive an exam and x-rays in order that the dental treatment plan be built specifically to that patient's needs. Once the treatment plan has been reviewed and approved by the patient or caretaker, we can begin scheduling based on the most pressing need first, as well as getting the patient involved with regular scheduled dental cleanings. At our Seminole program, patients have funding for 1 year for up to $2,000 in dental treatment. If the patient has dental insurance, we bill the insurance first, and then remaining out-of-pocket costs would be covered by the Special Day program. In Hialeah, dental treatment costs are not currently being covered by the Special Day Foundation, but they are in the process of fundraising in order to help patients with emergency care. We are cautiously optimistic that this will become a reality in the near future. The second part of the dental program that all 3 locations provide are off-site dental hygiene education visits. So off-site meaning we are traveling to our patients' group homes and day programs. At the Seminole location, we may also have the ability to do this in the patient's home. These visits encompass dental screenings, one-on-one oral hygiene education, fluoride treatments, and are a direct referral source to the dental clinics. As a dental hygienist for these programs, we not only oversee the care the patient is receiving at the clinic, but we are providing desensitization and education to the patients and caretakers.
Okay, well, in our clinic in Naples, we only see pediatric patients. The Special Day Foundation works with University of Florida College of Dentistry with doctors that are doing a residency. So they are starting to become pediatric dentists. We do not have any limitation on the amount of dental care provided. We even do some ortho cases when they are not too complex. We also do IV sedation in our clinic and general anesthesia in Lee Hospital and in Physician Regional here in Naples. All these services are no cost to the patients.
Thank you. And I love that you guys are not only helping to increase access, but you're also, training all those residents at the different clinics. It's a really cool setup. So how can children or adults with autism apply for your program?
So although the funding year technically starts every July 1st, applications can be submitted at any point in the year. There's a different application for each clinic location, and those can be found on the Special Day Foundation website. And once an application is received, it is first reviewed for the state-defined developmental disability qualification. And once approved for qualification, the applicant is either added directly to the funding for the current fiscal year, or placed on a wait list depending on the number of current patients and available funding. We don't require proof of diagnosis or citizenship, but we do reserve the right to decline funding if we feel applicants have falsified qualifications. Also, a patient's location does not affect acceptance into the program. If the patient can get to their clinic location of choice, we will do our best with the resources available at that location to treat them.
Yes, for some of our patients here in Naples, they don't live here in Collier. They are coming from Lee County, Henry, De Sotos, just to mention some of them. And I want to clarify that in our clinic, we don't have a waiting list. So we enroll all our patients and they automatically get the benefits from the program.
Yeah, it sounds like it's really depending on the number of applicants each clinic location gets, and then the funding that you guys have, and
correct,
kind of like the current patients there as well and what their services are. I just wanted to kind of take a moment before Yasmin has a chance to ask the next question. We had a question from Ruth about, are the services that Special Day Foundation provides limited to children, or are they available to all ages?
Well, in the case here in Naples, it's only for children.
correct.
Whitney can explain more about.
For the Seminole and Hialeah locations, we take all ages.
I think, Whitney, you basically said, as far as like how young for the children, it's really more determined by like maybe around 5, but basically when they can tolerate maybe sitting
correct.
in a chair.
We have patients since they are 2 years old until they are 21.
Right. We kind of have the rule of thumb, if the patient can sit in the chair, then we will try to see them. So generally that is around the age of 5 as far as cooperation. And that's even cooperation for a child that doesn't have a special need. So that's just taken into consideration as well.
Yeah, they'll kind of depend on each child as well. Yeah. Oh, and then thank you from Ruth.
Yeah, no problem.
Okay, Yasmin, if you want to go ahead with the next question.
Sure. And based on what you see in your clinic, what are the most common dental issues or challenges that individuals with autism experience?
So I can only speak for the location that I work in, and that's in Seminole. But the most common dental issues that I see are basic oral hygiene care and behavior management. So this doesn't just mean our own clinicians' ability for patient management, but it also includes patient and caretaker education on tools that can be used at home to help desensitize their loved ones to not only dental treatment in an office setting, but desensitizing them to basic oral hygiene care at home. So barriers to receiving care come in all shapes and sizes, but when you have a patient that is combative, self-injurious, and outright refusing to let you brush their teeth, it can leave all caretakers feeling helpless and abstain from pursuing any continuous care. So we are here to help, to provide that care. We have to get comfortable being uncomfortable. And that takes practice, confidence in your ability to provide proper care, and then confidence to execute that care safely. So I don't think anyone is going to argue the importance of dental care for any individual, special needs or not. So in my opinion, it's just a matter of prioritizing dental care just as much as any other aspect of healthcare.
Well, for the patients here in Naples, it's the poor oral hygiene, dental decays, and gingivitis. We hear so frequently parents talking about the challenge that just the brushing of the child teeth could be. It's very important that these children receive dental treatment because they can develop more cavities due to the difficulties with their oral care. We see our patients every 3 months for checkup, cleanings, and fluoride treatments. Doing this, we avoid the incidence of cavities and we stop the growth of them. Our goal is to decrease the number of IV sedation and general anesthesia for routine dental care.
Oh, that's I love the perspective you guys are sharing. You know, as a public health professional, I love this this perspective of prevention first.
That's the most important, yeah.
Yeah. And what supports do you have for serving patients with autism that a typical dental practice would not have?
So all of our programs work with CARD and providing each resident class with special needs dentistry support training at the beginning of their residency year. And then, as mentioned previously, the Seminole location has the ability to sedate patients that may not be able to receive dental care otherwise due to behavior. And we also allow longer appointment times and have tools in each operatory to aid in sensory serenity. All of the programs have the heart for special needs care as well, and having that desire and willingness is a rare find in itself.
Okay, well, here in Naples, we have a sensory room in our clinic. We use this room 2.5 days per week, and the patients are given 1 hour appointments instead of the normal 40 minutes that we normally do in the general clinic. This helps to provide additional time to maximize the behavior improvements and the desensitization for these patients. There are some desensitization tools for this patient to help relieve anxiety, and I can mention some. We have some LED lights, we have relaxing music, we have sensory toys. Here in the sensory room, we are working with these children to improve the behavior. And the hope is that these children will require fewer sediations due to the children's acceptance to preventive and restorative treatments that we'll be introducing today in our sensory room. Special Day Foundation also provide additional training for us. We go to the Special Care Dentistry Association conferences every year. We also are bringing a speaker next October that is an expert on autism to train our residents and staff. And this is beside the trainings that we get from CARD. So we are also working with CARD on developing personalized social story that will help to explain to our patients what to expect during the dental appointment so they can come ready for what we are going to do.
I mean, I think like building a whole separate sensory room might not be as feasible for every private practice to implement, but I think a lot. Thank you, Ali, for sharing some of those examples of those sensory supports. You know, like just having like some sensory, like sensory toys, or like the headphones, or like some sunglasses. Those are
weighted
things,
blanket.
The weighted blanket. Those are things that are pretty easy, and any practice could probably implement.
Yeah, the headphones themselves are just asking a patient to bring in their own headphones, and then a weighted blanket that's not very expensive to buy. Little things like that. It's pretty easy to implement in any operatory.
Yeah.
Yes, we recently just changed the light in the operatory room because we have the sensory room, and when the children allow us to be seen in the operatory room, we have the dental chair there, and I just changed the lights. We just put LED lights, and it's been a huge change. Now the children can go more comfortable inside. They can even choose what color they want for the room, and they love it. I put some like stars in the ceilings, and they are enjoying much better their visit in the dental chair.
I mean, that sounds like, who wouldn't want that? I mean, that sounds fun for my own dentist.
Yeah.
Dim the lights and turn on the stars, please.
Yeah.
Yeah, I mean, I think what you're mentioning with the light bulbs, because I know so many of, you know, not only children, but adults with autism have let us know that, you know,
they are sensitive to the light.
Like the fluorescent is like staring directly into the sun. And it's like, yeah, I mean, you're not going to want to just sit there and have your teeth clean if you're being staring into the sun.
Yeah.
Is there anything else that you would like to share with our audience?
Well, yes, in my case, I want to share our Facebook account. We have a general account, but especially for our clinic in Naples, that our program is a little bit different. We have this account called Special Day Foundation Naples, where you can see what we do in our sensory room, how we approach our patients, and how we treat them. I also want to mention that we have our outreach program where we go to facilities where they take care of patients with developmental delays. We are currently going to one facility every 3 months where we provide exam, oral hygiene instruction, and fluoride treatments. And if we see that those patients need more dental treatment, we refer them to our clinic. And we are also in the process of expanding this outreach program to 2 more institutions to provide our service to them.
And then I would just encourage educating yourself on tools to use at home to help with desensitizing your loved one, as well as actually taking the time to practice those tools. Our general Facebook page can be found if you search for Special Day Foundation, and it's always posting educational content to aid in compliance and resources. Also, check out our fishing program. Captain Mark is amazing, and the program is free.
I had myself muted. So I've gone ahead and shared all those links in the comments section for our audience. So I know we already have one question, but for anyone else who's watching, if you have questions, please go ahead and put them in the comment section below. Even if you're watching this after we get off the air, we continue to monitor the comment section, and we can also forward those questions to Whitney and Allie, to get a response. And then if you have an idea also for another related episode in the future, let us know too, and we'll make sure to give you credit on the air for coming up with that idea. So let me go ahead and share the second question from Ruth, which was, as hygienist, do you recommend a specific type of toothbrush?
Good question.
Well, in my case, we are working with a toothbrush that we call surrounded toothbrush. That is a toothbrush that when it's very comfortable for the parents. The parents love that toothbrush because when they brush their shy teeth, they are brushing the front, the back, and the top at the same time. So sometimes you have to be in a hurry. Most of the time, they cannot spend the 2 minutes that is required for a good brushing. But at least if they go fast, they can be sure that they are doing all the surfaces at the same time. Mm-hmm. I mean, electric toothbrush will be ideal, but most of our patients, they cannot tolerate the noises and the vibration that these machines make,
Mm-hmm.
Right. So there's the surround toothbrush that Allie mentioned, and then there's also another one on the market called the Collis Curve. So it's COLLIS Curve, and it comes in different sizes and different bristle softness. So I always recommend the soft bristles. But it's this similar concept to the surround, where it has bristles that kind of like semicircle on the toothbrush, and then there's a line of bristles in the middle of the toothbrush. So when you're brushing, you don't have to worry about the angulation, especially if you're brushing someone else's teeth. You just kind of put the toothbrush on the tooth, and it's going to get all sides of that tooth in one swoop. And then as far as an electric toothbrush, again, like Allie said, that is most ideal. There is one on the market that has a surround head on it. I can't think of what that one's called at the moment, but I always suggest having an electric toothbrush of some kind, even if it's just a simple battery operated one, because you can always try to use that as a desensory tool. So let's say you put the toothbrush in the mouth and start with the toothbrush off, then turn the toothbrush on, then turn the toothbrush off again. to kind of play this game of on off as you're brushing your child or the person you're taking care of's teeth. And that over time could potentially help desensitize them to having the toothbrush on. And then that can also revert to a dental setting with all the sounds and vibrations of the dental tools.
Yeah, I'm really glad you brought that example, Whitney, because that's with my like I mentioned at the beginning of the show, I have a younger brother with autism, and getting dental care has, especially when he was younger, was always a huge challenge. But that was one of the things, that was basically the exact way that my parents got him comfortable with electric toothbrush. And then that helped with later on then being able to tolerate the cleanings and just the sounds in general of when he goes in.
Sometimes we forget that like an electric toothbrush turned off is just like a manual toothbrush. So you don't have to be switching toothbrushes, just turn the vibration off and use it like a regular toothbrush. And then kind of slip in there that little on for a split second and turn it off and just see how that goes. It might not work, but you might be surprised.
I think for Kyle, what also helped was like the fact that he could turn it on and off, and so he felt like that sense of control, and that it wasn't going to be like a surprise, and that he got to pick that it was like a Thomas the Tank electric toothbrush, and so using his special interest to get buy-in.
Yes, that's a good point.
Right. Well, I don't think we have any more questions, but we also we did get a big heart from Julie Savalbe. I think that's how you pronounce her last name. And thank you guys for the information. And again, if anyone has questions after we go off the air, please go ahead and put them down, and we'll make sure to pass them on over to Whitney and Allie. So we're almost to the end of the show, but I didn't want us to leave without saying thank you to Whitney and Allie for bringing this valuable information to our audience. Like I said, I really love how your program not only helps individuals with special needs access the dental care they need, but also trains those, future dentists so that they'll be better able to serve patients with special needs in their private practice.
Thank you for the invitation. It's a pleasure.
And I also wanted to remind our audience that we are on the air every other week. So our next episode will be on July 28th. So please put that down on your calendars. You can't miss it. And then I also want to share before we go, I'm going to be posting a link in the comment section for a survey for our show today. Even for those of you who have been super nice and done this before for us in the past, if you could please go ahead and do it again. It's just 6 simple questions, just letting us know what you thought about our episode, and also kind of helps us to justify the time that we take for being on the air. So thank you. Also wanted to remind us before we go to please give us a like, follow our page, and to again set reminders for every other Friday at 10:45 to join us here so we can share a cup of coffee with you as we spill the beans on important topics related to autism. So until then, we wish you good vibes and hot coffee. Bye, everyone. Thank you.
Bye-bye. Thank you.